Hi, I'm Bill Chisholm. I live in Atherton, California. It was probably 6 years ago, sort of my late 30s, I did something really crazy. I did an Ironman triathlon, and during the race, I started having some really it was really, really hot, and there's all kinds of metabolic distress going on in my body, I'm sure. And I started having some chest pains towards the end of the Ironman, and like a crazy person, I kept going, and I would manage my heart rate, and then it would kind of go away and it'd come back. And when I finished, I just felt I felt horribly, and I ended up in the tent after the race for what seemed like forever, probably a couple hours. And then I went on vacation and just I tried to go for a run about a week later, and I made it about a mile after having been in shape to do an Ironman, and knew something was wrong. Originally, I went to the Palo Alto Medical Foundation, the clinic, and I learned that if you go into any hospital and tell them you're having chest pains, you go right to the front of the line. So they quickly got me over to Stanford into the emergency room, and they did some triage there and figured out that thankfully it was atrial fibrillation, not something more serious. But and then I spent a couple days in the hospital kind of getting it back in rhythm, and then started working with doctors around different medications, that kind of thing. I originally went the path with taking the medication. It seemed there was there's some side effects there's some danger associated with any surgery, in that one in particular. So went that route to see if I could get it under control initially. I did not have side effects from the medication. They just didn't really work, to be honest. I went on a trip to London for work, and I got there, and there were really important meetings, and I had been taking my medication and everything, and my heart got out of control, and I couldn't get it back in rhythm. Usually if I would lie down and take a nap or something, it would come back in, but it wouldn't come back in, and it took me like a day to get it back in, and I just felt horribly for that whole day, and decided that life's too short when there's other options to kind of fix it once and for all. It's a pretty barbaric process. It became pretty clear pretty early on that it's still kind of an art as much as a science, the way that they do this. So it's not perfect. They go in and they burn the heart. They don't always get all the hyperexcitable tissue. So there's that there. While 75% of the time it works first time, then you oftentimes have to go back. So that was one of the kind of the things to consider kind of going in. The second one is that, like any surgery, it's dangerous, and the heart sitting right on top of your digestive system, if you burn through there, obviously then bacteria get in, that's game over. It might be the next day, it might be the next week, but that's terminal. And then as I was having mine, there still were issues of people having strokes during the procedure, and it was percentages, 2, 3, 4% of people having a stroke during the procedure. Now you're on the table, and they kind of can deal with it quickly, but that certainly was a consideration as well. I was out cold for the whole thing. I think it was about 4.5, 5 hours. There was quite a bit of excited tissue in my case, so they had to do quite a bit of work. When I woke up, the first thing I said apparently was, "Am I still alive?" Which is kind of funny. But then the recovery was pretty quick. I would say I was home for a couple days, and then I could go back to work. But then I was on blood thinner for quite a while, and I have to go in and get blood draws to make sure that was balanced out and everything. And that went on for a couple months. It worked. I didn't have a single episode for probably 18 months to 2 years, and now I still have episodes, maybe tied a little bit more to exercise now, but I can live with that. It doesn't work all the time, and it's dangerous, and kind of getting those error rates and the stroke risk, getting that down into less than 1% kind of range seems like it should be something that we're striving for.